You may want to read your facility's written exposure plan. Always take universal precautions when there's a chance you could be exposed to bloodborne pathogens. Remember these protective practices when you're facing bloodborne pathogen concerns. Always wear personal protective equipment. Never eat, drink, smoke, or apply lip balm on areas in which there's a possibility of bloodborne pathogen exposure. Never manually compress trash. Avoid splashing or spattering when cleaning up. Never reuse towels or sponges. Use spatulas, absorbents, or tongs for cleanup when possible. Handle contaminated laundry cautiously. Use properly labeled or color-coded containers and bags when disposing of or transporting materials contaminated with bloodborne pathogens. This includes gloves, laundry, and equipment. Always decontaminate surfaces and/or areas with Betco Quatstat or TB Plus or other appropriate disinfectants. Always properly wash your hands. Disinfect equipment and materials used for cleanup. And if you think you may have been exposed to bloodborne pathogens, contact your supervisor and physician immediately. If you need more information, ask your supervisor or check out the OSHA website at www.osha.gov. You can also contact your regional OSHA office, which is listed in the accompanying workbook, or by clicking on the OSHA Regional Offices section of the CD-ROM. Remember, you play an important role in preventing or reducing contact with bloodborne pathogens to others as well as yourself. Be proud that you and your employer have taken the time to learn more about the OSHA Bloodborne Standard and use your knowledge to make a difference in creating a safe, clean, and healthy environment. Employees in a healthcare setting have an even greater risk of exposure to bloodborne pathogens. Here are some additional guidelines developed for your protection. Do not bend, recap, or remove contaminated needles and other contaminated sharps. Put contaminated reusable sharps in designated containers until they can be properly reprocessed. These containers must be puncture resistant, labeled or color-coded, and leak-proof on the sides and bottom. Regularly inspect and decontaminate all bins, pails, and other containers that may have come into contact with infectious waste, such as needle bins or trash receptacles. Of course, follow universal precautions and dispose of all regulated waste according to all applicable local, state, and federal regulations for infectious waste disposal. Again, if you need more information, ask your supervisor or check out the OSHA website at www.osha.gov.